Hey there, welcome back. Today we're tackling a book that's as explosive as it is eye-opening. Medicine Cult, A Prescription for Side Effects and Death by John Virapen. Let's start with the man himself. John Virapen isn't your typical author. He's a Swedish citizen living in Germany, but he's originally from British Guiana. He spent 35 years in the pharmaceutical industry, climbing the corporate ladder, rubbing shoulders with executives, and seeing firsthand how the system works, or doesn't. And what he reveals in this book is nothing short of shocking. He pulls back the curtain on Big Pharma, exposing a world where profit trumps patient safety, where corruption is the norm, and where the drugs you take might be doing more harm than good. Now, Virapen doesn't hold back. He starts by defining corruption, and he's not just talking about a few bad apples. He's talking about systemic corruption that's woven into the fabric of the pharmaceutical industry. He explains how companies manipulate data, hide side effects, and push drugs onto the market without proper testing, all in the name of making a buck. And the worst part? This isn't some conspiracy theory. This is coming from someone who was on the inside, who saw it all happen. Let's talk about one of the most jaw-dropping examples in the book, the story of benoxaprofen, a drug marketed under the name Oprin. This was supposed to be a miracle drug for arthritis, but it turned out to be a death sentence for many. Virapen was working for Eli Lilly at the time, and he was tasked with preparing the marketing campaign for this drug. He spent millions on lavish conferences, exclusive gifts for doctors, and even hired famous artists to perform at dinners. But here's the kicker. While all this was happening, people were dying. Reports of severe side effects, including kidney and liver failure, started pouring in. But instead of pulling the drug, Lilly doubled down. They hid the data, silenced whistleblowers, and kept pushing Oprin onto the market. It wasn't until dozens of deaths were reported that the drug was finally withdrawn. And even then, the fines Lilly paid were a drop in the bucket compared to the profits they made. But it doesn't stop there. Virapen also dives into the world of antidepressants, specifically Prozac. He reveals how Eli Lilly manipulated clinical trials, ghostwrote studies, and bribed doctors to promote the drug. And here's the scary part. Prozac was originally developed as a weight loss drug, not an antidepressant. But when they realized there was more money to be made in treating depression, they rebranded it. And the side effects were downplayed, ignored, or outright hidden. Virapen even talks about how he was instructed to never mention the negative effects of the drugs he was selling. It was all about the features, advantages, and benefits, never the risks. Now let's talk about the bigger picture. Virapen argues that the pharmaceutical industry isn't interested in curing diseases. Why would they be? If they cure something, they lose a customer. Instead, they focus on managing symptoms, keeping patients dependent on their drugs for life. And they do this by creating new diseases, rebranding old ones, and convincing people they need medication for things that were once considered normal. Shyness? That's now social anxiety disorder. PMS? That's premenstrual dysphoric disorder. And don't even get me started on the overprescription of drugs like Ritalin to kids. Virapen calls it what it is, a profit-driven machine that preys on our fears and vulnerabilities. But here's the thing. Virapen isn't just pointing fingers. He's also offering solutions. He talks about the importance of critical thinking, of questioning the information we're given, and of taking control of our own health. He encourages people to explore alternative treatments, to consult with doctors who look at the root causes of illness rather than just treating symptoms. And he calls for more transparency in the pharmaceutical industry, for stricter regulations, and for holding these companies accountable for their actions. So, what's the takeaway from all this? Well, for starters, don't take everything at face value. If your doctor prescribes a new medication, ask questions. Do your own research. And remember, the pharmaceutical industry is a business, and like any business, their primary goal is to make money. That doesn't mean all drugs are bad or that all doctors are corrupt, but it does mean we need to be vigilant. John Virapen's medicine cult is a wake-up call, a reminder that we can't blindly trust the system. It's a call to action, urging us to demand better, to hold these companies accountable, and to take control of our own health. Because at the end of the day, it's our lives on the line. That's it for today's episode. If you found this as eye-opening as I did, share it with someone who needs to hear it. And don't forget to subscribe so you never miss an episode. Until next time, stay curious, stay informed, and take care of yourselves. This has been a BrightLearn video from BrightLearn.ai on John Virapen's book, Medicine Cult, A Prescription for Side Effects and Death. Visit BrightLearn.ai for more fascinating videos like this one and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.